Have you heard the news? It's getting lots of rave reviews. A good time is waiting just for you at Sister Spokesman. Girl, won't you send the fact?
So we're going to start off with Monisha. Since we ended with her, we're going to start off with her. So Monisha, how would someone know if they are considered a caregiver, and what type of caregivers are there out there? So what different types do we have as caregivers?
Good afternoon. I know you touched on that a little bit already, Tracy, the different types of caregivers. I want to say that I was a caregiver for many years, as she stated, and 1 out of 5 people in America have been caregivers at some point. And 83% of those people are actually family, friend, and unpaid caregivers. So we have the paid caregivers that we know about, PCA, CNA, people who are nurses, people who are out there serving the community and being caregivers, but however they're paid in those positions. And then you have the ones who, just like me, it's my mama and I'm taking care of her because it's my mama. Right? Yeah. She took care of me, so now I'm taking care of her. So then you have the ones that actually take care of them just because they're someone they love. But I was someone that was called a sandwich caregiver. So as a sandwich caregiver, I was also taking care of my children, right, as well as my mother. So you're in between both of those duties. And then you have the ones, there's different supports around caregiving. So you have the solitary caregiving where one person does all the caregiving work. I don't know if some of you out there might be that one, but I was one of the ones. Okay. Anybody identify as the one? And then you have the observed caregiver, the one where the person does all the work, but other members have an opinion about what they should do or what should be done.
Right. I get a lot of that.
So I came from a big family, so you have other people that might be like, no, you ain't doing it. Mama said, right, we want it this way, but they're not doing the actual work with mama. Then you have the tag team approach, right, where there is a member and different members of the family who do different roles in the caregiving. So mom may stay with one, but then the other person might do the grocery shopping, or the other person may be the one that does the finances for mom. So you have multiple different people doing different positions in the caregiver role. And then you have those situations where there's that uneasy caregiver alliance, where it's a situation where members share the work but may not be on the same page. So they're trying to do stuff, but they don't stay on the same level with it. And then last is just the people who all come together and figure out how to work with mom, and maybe mom stays over here for an amount of time or stay over there for even long distance. You have people who live out of town and then they're supporting them through the phone or however they can support, and then they come to Minnesota for the summers because it's cold out there, and they go to Arizona for the winters, right? So they might switch off roles. So you have different scenarios when it comes to caregiving.
And one thing for sure, thank you, Monisha, and one thing for sure too, when you have that caregiving scenario where the families are not quite online, it's important that when family members want to be involved with the caregiving process, that they get online with the main caregiver. Because it's like, there's a lot of times, even for my mother, where I have a PCA that comes into the house and no one takes in consideration that girl's there getting paid to take care of my mother during certain hours. So you encourage your families to then schedule the lunches around that person, so you're mindful of that person, because if she goes home, she's not getting paid because family members want to take mother to lunch. So how about pick mother up for breakfast? How about pick mother up for dinner? Right. And so I think it's important that the people that are not the caregivers, the people that are the caregivers but not the immediate caregivers, when they're sharing the responsibility, make sure that you check in with the primary caregiver. So that if there's a schedule that you're being respectful of everybody involved. So that's a very important thing, and a lot of people just kind of think they can get in where they can fit in, but we're talking about lives here today. Fartun, how can I find culturally inclusive caregiving resources for my community?
Well, good afternoon. Thank you for inviting me. Staying with the same question that Monique had asked, the reason that our community. So I'm an immigrant, but I've also identified as a Black woman and African woman. So the biggest problems we face, like culturally specific, and what you just talked about, is our family members come in and they mess up the system that was created. So the PCA, the other caregivers, they just mess up the schedule because of wanting to come in when they want to and not realizing that something needs to be there. So I agree wholeheartedly. We need to work with the person who's the lead for the person that's being cared. About culturally specific services, I've been in Minnesota for 22 years. Like my background, I'm a healthcare worker. My older brother had a polio, so as a young person, we started caregiving mom and us, because dad had passed away. So then he came to here, we migrated here, and he had hip surgeries and a lot of surgeries, and because the larger family members are not here, he ended up being the only person that's caring for him before he got married. So we've struggled to really find, again, nursing homes. As someone who does PCA, we didn't know anything about that. Like when Monique said, 83% of the family caregivers who are not paid. That is who we belong to. And so what I've been thinking about is, we already have so much strength in taking care of our members as a culture, community of color. We take care of our people whether we're paid or not. Mm-hmm. But we also need to go out and earn income.
Right.
Because if you're staying home and caregiving your loved ones, that means you're not earning income. You tend to be in a low income or a struggling income-wise. Mm-hmm. So how at least that I'm thinking about, that I've been thinking about, is the reason I opened my center, is a multicultural center. I had no idea. People look at me and they say, oh, you're Somali, you're Muslim, you only must serve your own people. I'm like, no, my own people are everyone. Yes. Especially those who are not fitting into the mainstream culture. Mm-hmm. So the most critical thing, and I've been telling to my African American family members and friends, you have to build your own centers. Mm-hmm. And it's complicated how it is, but that would be the foundation of first. Because many of us are 18, including myself. Mm-hmm. And so number one is thinking about how we create our own centers. Number two is really being educated, like people like Monique and others, to teach us and teach you how to navigate the system. Mm-hmm. Access is an issue. I don't have to tell you that. I'm just here as an immigrant. You guys have more experiences than I do. What you don't know, you don't know. Mm-hmm. Our families, the counties have so much money to serve our members and those who are taken care of. Because we have no idea, we're either underpaid or not paid. So how do we be educating, getting our own centers, and the third thing is advocacy. Really advocating for your loved ones, getting close to the case manager of your loved ones, making sure that the case manager and you develop a relationship. The case manager plays a role of whether your loved ones are served well or not. Mm-hmm. Don't settle first thing that they give it to you. Is it me? Okay. So the case manager who your loved ones being assigned is critical. Ask also to visit, say, I need a culturally specific centers. What I know is 99% of culturally specifics right now led by immigrants. Mm-hmm. So immigrants themselves and African American, I've seen in my center huge cultural differences. Yes. Mm-hmm. So we need to adjust to each other and learn from each other. Mm-hmm. So work with the case manager. Know that when it comes down to non-white caregivers right now, from the report that DHS was given to the legislator, 70% are women of color. Mm-hmm. As Monique said, even the ones who are paid, yes, us as a woman of color, we're underpaid as well. So we need to negotiate, getting as a community, networking each other, if the case manager is not really working on behalf of your loved ones, don't be afraid to ask someone that will care for and ask what you need for. Thank you.
Thank you for joining. So Maria, can you tell me, because Fartun mentioned the fact that, you know, you don't know what you don't know. So that's one of the reasons why we're here today, is so we can find out what we don't know about caregiving so that we can be a better caregiver. So can you tell us about the different types of care and living options available for older adults?
Yes, good afternoon, and thank you for having me. So there are different options for your loved ones, different types of living options. You can use the aging in place, and that's where the senior chooses to remain in their own home. There's also the in-home care. If your family member wants to stay in their home, but they begin to need help, they have several options for in-home care. And then we also, you can use the moving a family member into your own home. And if you have space and can handle the day-to-day family member, you may want to think about inviting them to come live with you. There's also independent living communities, and these are usually apartments and condominiums that your loved one can stay in. And they even have doctors and nurses regularly visit, so your loved one will be taken care of. They also have assisted living communities. And this covers the middle ground in the spectrum of senior living. They serve elders who need more support. They can get living independently, but who don't need complex medical care daily. And then there's the continuing care retirement communities, which offers a range of elder care options, from independent living, assisted living, and they have skilled nursing, all in one place. And there's care homes, also called family homes, and they are usually private homes that have converted their space into elder care for a small number of older adults. And there's skilled nursing facilities, and they provide round-the-clock medical care for your loved one. There's memory care facilities, and that's normally for seniors with Alzheimer's or other forms of dementia. And it's a secure place where they can go, because most of the time with dementia they get confused and they wander. So they have staff there, trained staff to provide care for them. And you can find a great deal of information regarding caring for your elderly loved one on the website care.com, and it gives you lots of options as far as living options. Thank you.
Well, thank you. And one of the things I want to add to what Maria was saying is that the thing too about caregiving, the ideal place, if it's at all possible, is home, because everybody loves the comfort of home. Right. So if you're able to get services, and there's a lot of services out there that can set it up, and it just depends on how much caregiving your loved one needs. Some can't be cared for at home, but some can if they have a limited amount of needs, where someone can come in throughout the day or get some home health care services that can come and work with your loved one. So always do that. But if it turns out that you need to put them in a care facility, try to make it, if you got a family, that you can rotate visiting with, because that's so important for the loved one, for so many reasons. But one of them is just so that the facility knows that you're watching. Yes. And that's just on the for real. Because if you leave anybody kind of anywhere, and no one knows or thinks that anybody don't care about them, they're the last ones they're going to care about.
That's right.
So you can't take them and leave them and not go by and visit them and not make it a frequent visit. So make sure, if that's the option that you have, to put them into a care facility, that you stop and make a routine of going by and checking on them. Because that way you know that they're getting the best care that they're going to be able to get.
Yeah.
So So Fartun, can you tell me what kind of caregiving resources are available for those with physical and mental disabilities? So we're not just caretaking for elders, we're caretaking for a lot of different people. So can you talk about that?
Yeah, yes, thank you for the question. So like I said, I've been looking at specifically right now the health disparity of our community. And since I'm an immigrant, I've been here for 20 years, there are no enough data about us. So next community that I utilize their data and look at the reasons inequality exists and lack of access exists are our cousins, the African American community. And really it comes down to lack of access. It really comes down to that. And so because, and you probably wonder, because it was never designed to serve us, you and us.
It's true.
Your opportunity for self-care and being healthy and independent at your home is never, it's never at the conversation. So as an advocate and a health educator, I get so mad about it. So what are you talking about? In terms of the communities, non-ethnic groups, they have the long list of opportunities. Here you can get a caregiver, you can get 24-hour service, you have a respite. I ask all of my African American and even immigrants, Somali, say, well, do you know respite care? No, we've never heard that. So that is a service that the caregiver is supposed to get. So he could go to church, do her hair, he can walk out and go to the gym, do socials, because we know the caregivers die in speed of unbelievable before the person they give the care. So social inequality, you know this, is a critical aspect of what's going on with us. So how do we find out is doing more of what we're doing here, talking to each other, also calling the commissioners, finding out what is available for non-ethnic individuals. I actually listed the areas to call and to connect was Senior Linkage and Volunteers of America. Those two Volunteers for America is where I actually went when I started my small business and met my sister here. But again, it really us putting part of the advocacy in what we don't know. Any services that non-ethnic groups are getting, we should be able to get. But again, we need to have the list of things that we have. So I will, there are a lot of services, many services that aren't available for us. The respite, the ILS, there's what we're using, the communities of color are given are also the most underpaid services. Like PCAs, the homemakers, the PCAs and the homemakers don't really pay that much. So now when you try to find someone, they say, find your loved ones to work for you. Well, why would you want to pay my loved ones? Because anyone else will not be paid that much and stay with you to stay, long term. So underpaying our loved ones, again, it comes down to us being challenged economically and financially because we were trying to serve our people. So I would say Volunteers America Connect, there's a serial linkage. They're connected to other services that you can find out, but it's really us knowing what services are available for us. And so look at respite, look at IHS with training. So it's not only the person who's at home can be helped to do their laundry or do grocery store, but a family member who may be aging, who maybe have different disability, can also benefit from the person who's coming to work with you. IHS with training pays $17 to $22. Imagine if your loved one is going to get paid that. It's going to lift up your economic of the family and also be able to do more work. So us knowing what's available for us, doing this advocacy, immigrants and non-immigrants coming together and learning from each other will be really amazing opportunities for us.
Monisha, talk a little bit about how you can give advice on how to advocate for your loved ones. And I know it was a couple parts to this question, so I'm gonna just let you answer that one first. I'm gonna get into the second part of that.
Yeah, so Fartun was speaking about advocating, right? I heard that a couple of times. And advocating for your loved ones, like Fartun said, is really knowing who their providers are as well, making sure that you're showing up at those visits with them. As Tracy said, if they're in a facility, you go to that facility. You figure out who's working with your loved one at those facilities, and then making sure that you show up even if it's not you, maybe it's someone else, and you figure out a time slot. Oh, I'm gonna go on Monday at this time, between this time and that time, and then my brother's gonna show up and he's gonna go and take the later shift or whatever it is, but you're making sure that you're knowing who's working with your loved one. Also, sometimes when you're caregiving and you go into the office with them, maybe it's the doctor's office, they may speak to you as if the person you're caring for isn't even present.
Right.
So you make sure that they're part of the conversations as well, that their needs and their concerns are being heard. The reason why I became a community health worker is because I realized that the patient advocates at the doctor's office wasn't advocating for my mom's wishes. They were advocating for what the doctors wanted. And I'm like, that's not what my mama said. My mom said she wanted this. And they would be like, but the doctor says this. Who knows the doctor? Who knows your mother better? You or the doctor? And who knows what they want better? Your mom or the doctor? And so I'm like, no, mama says she wants you to do this. And I had to stand on those grounds. She wanted a culturally specific facility. We found a culturally specific facility when she had to get to that point, but they weren't trying to do that. But guess what? It was out there. And so you have to push them to do what your loved one wants. Also, we are not married to the doctor. We did not make an oath to the doctor that we see. We don't have to stay with the doctor that we see. It is okay. You are the consumer. It's okay if that doctor is not listening to you, if they're not hearing your concerns, or whoever the care person is. If they're not doing what you want them to do, it's okay to get a second opinion. It's okay to go see if there's another doctor that's out there that will listen to your concerns, that will look for those culturally responsive resources and will work with it. It's okay. Because I think a lot of times we like, oh, we've been with Dr. So-and-so for 20 years and we can't move around. Yes, you can. Find another opinion, find somebody else that will work with you, that will hear your concerns, and that will listen to that. Even when it comes to medication or whatever it is, it's okay to make sure that they're listening. And you are the voice when they cannot voice it for themselves. So make sure as a caregiver that you're just hearing your care, whatever the care recipient wants, and then advocating for that need.
That's a good one. And certainly too, isn't there like, talk a little bit about like, because I know when I heard the word, when I just lost my thought, I'm sorry. When they're talking about hospice, that's the word I'm looking for. So hospice care, I was under the impression that it was more just about you going to the hospital and that's where your resting place is, but they also offer hospice care in the hospital. Can one of you talk about that a little bit? I mean, in the home, not that you can get hospice care in the home. Can you talk about that?
So that's a great question, and I worked in an ICU for Methodist Hospital for 4 years, and always there been a struggle of your loved ones in taking them to hospice care. So let me just go back to advocating. Thank you, Monique, for saying that you can divorce your doctor. Seriously, where we've been told, you stay with them, there's loyalty and all that, please, if in case like when someone's getting older or their disability, we've seen our center and other places where they just medicated, the person just being prescribed so much medication, and we just say, go get the pharmacy, take medication, and your loved ones who used to brush their teeth, who used to eat, or used to move around, all of a sudden they're falling. And then that is a one-way ticket to nursing home or other facilities. You need to be vigilant about your loved ones. I believe doctors too, but I can realize we need to tell them no and maybe also find other choices. When it comes down to hospice, we as communities of color, we struggle because social connectedness is the biggest asset that we have as a community of color. We keep our grandparents, our aunts, even those who are childless, we keep them. We don't send them to nursing homes. So you have to make a decision if your loved ones say like they're in G-tubes, they have a lot of machines, they cannot breathe, they're unable to care for at home. Then you say, okay, maybe this is a good time for your loved ones to go into the hospice. But that doesn't mean at the end of all, you need to be absolutely, like Monisha Richard said, you need to be there. Because even if your loved one is leaving us, you want to make sure they leave us with dignity and cleanliness and well cared for. Because even though their brain or they're struggling to go out of this world, they're still feeling that whether they care for their loved ones are there. So you need to stay vigilant. If this person is dying other terminal and they're using medications and other things, you can keep home, but absolutely receive the care you need. Is it 24 hours nurse? Is it someone who can give you respite? There's so many opportunities that you can do, but that depends on the severity of your loved ones versus if you want to keep home because they're only going to take medication, pills, or even a G-tube or some trick, the tube that makes them breathe. If that is manageable at home. But if they're vegetative stage and you're aging or you're getting tired of doing that and they need every couple hours or every hour being turned, then you decide you want to take them to a place that will care for. COVID-19 taught us what we already knew about the inequality of our communities of color in hospitals, in nursing homes. I've lost, some of our adult day centers, we've lost a couple of African American members of ours, but I wasn't just someone who serves them at the day center. I was at the corner. I was calling the nurse, I was calling the family members who are some out of state, and some out of state people will come here, but they don't have a hotel, or they don't have a relative. So please make sure, if your loved ones are out of town, that you make sure there's someone that you have a guardianship, whether it's a temporary guardianship or any guardianship. So then the biggest other problem we lose is our asset. If someone is here and all of a sudden they end up in ICU or respite, guess what happens to your asset? The government, it lost it, it goes to somewhere else. So decide the severity with a family member, and then you decide what you want to do.
So, we're gonna just be off the mic for a minute while we try to get this schooling taken care of. But in the meantime, I can talk about the need for doing a trust. So, when you have a loved one that you're taking care of, and like she was saying, you gotta consider the fact that, one day they could pass before you, and you're dealing with the whole ideal of what didn't get taken care of before they died. So in order to make sure that the state doesn't come in and then hold everything hostage as little or as much as it could be, is start to think about getting your loved ones involved in a trust. So at that point, you don't wait until it's too late, because I know a lot of times we wait until someone's near dead, and then our first question is, well, what about this? Well, what about that? Well, what did they want to leave? Or what did they want with this? Or what try to get all that handled while you can. So talking to a lawyer about a trust is something that would be very important to your loved ones when you're caregiving, because even if they're not, even at this point, I don't have any illnesses that I'm aware of, and I'm talking about getting a trust for my daughter. So if I take sick and she has to take care of me, the last thing she needs to worry about is what's going to happen upon my death. Right. What's going to happen with anything that I have of any value. I own a company, so of course I have a lot at stake that I don't want her to worry about. And I think we got to think about, when we're a caregiver, we got to start to think about things as hard as it is. It's hard, but it's reality, and it's harder if we wait until after the fact. So let's think about it. Wow, it's hard, but it's a conversation we need to have. While it's not as hard as when you're grieving. Because then you're grieving and you can't think. And then while you're not thinking, there's a whole bunch of people that still are. So keep that in mind as we continue to think about caregiving our elders or caregiving someone that's not older, but that, needs a trust that we don't have to worry about that. And also keep in mind, the financial end of it. The services are not free, and I think you did touch on that a little bit, but let's talk about it, and maybe you can just talk loud like I am for the time being, because we still want to pick up your voice on the camera. But we want to talk about what resources for finances, because it is, I've heard Monisha talk about you as a caregiver can get money to take care of your loved one. But what about if you have to put them into a place and you're trying to finance their stay there? Is there help for that?
So I want to also talk about why having living will or getting your things in order. I've seen also where the head of the matriarch of the family is in trouble, or she goes into coma, or he goes into coma, and then nothing stayed as was planned, because that's our culture. We don't do those things because it's a family. And then a huge conflict happens where the siblings are fighting over who is going to do this, and we really don't want to do that. So having a plan put together, whether it is who's going to even have this book, or what church you're gonna, your funeral, if, you go first would be that it's important to plan. The resources about taking care of your family members, if mom or dad or your loved one end up in a facility, that is also where the disadvantage of communities of color is here, because you focus so much taking care of your loved one that you're not thinking outside of what happens if this individual goes somewhere else, or what happens if this source of income goes away. So we need to think about plan A and plan B and plan C. That's why having a respite services, advocating for more hours where you can say like someone comes in from 8, say like 9 to 3:30. Your loved one may go to daycare, adult day center, or someone comes home and then you go find a job. You know what I mean? So start earning income. Or someone comes in 3 to 8, 3 to 1 p.m., 3 to say 9 p.m. That way you're earning income. So don't just rely on one income for your loved ones. You have to figure out, you have to have a plan to earn other income. Unless you yourself are struggling with some other illnesses and you yourself would be qualifying some disability income, if it makes sense. But don't rely on just one source of income. Plan other way of earning. So then when that comes, you have a backup system.
Yeah, and can I add to
Yeah.
that? I just wanted to add about having your wishes down, and so it's important to have a healthcare directive in place. And so you can go with your loved one and talk to the doctor about getting that healthcare directive in place. What are their wishes? Do they want to be resuscitated? Do they not want to be resuscitated? And it takes the burden off of you. Because I ended up in a place where that was the question for my mom. And at one point she did have it where she wanted to be resuscitated if it came to that. And then she changed it. And so that took the burden off of me. So it wasn't my decision. At the end of the day, it was my mother's decision. So I didn't have that battle between me and my family. Do we keep them on life support? Do we take them off? What is it? It's their wishes that you're honoring in that moment. And so making sure that you have that down and you can talk about that, as hard as that conversation may be, it really helps if something was to happen to that loved one. And it minimizes the arguments and the, no mama said this, no mama said, no she didn't. She said, no, mom put this on paper for us and this is her wishes. And now I don't have to worry about it being on me that she didn't want to be resuscitated. It was on paper and they went with what she wanted. And so that's important to put in place.
And that's very important, Monisha. Thanks for bringing that up again, because I know that the conversations that we don't want to have are always the hardest conversations to have. But when you put things in place before, even if it's somebody young and you're thinking they're not going to die, but still, everything needs to always be in place. I don't care the age, especially when they're being caregiven for. That's what we're talking about today, is when and even if you're not, even if I'm not being caregiven to right now, but for the grace of God. But I also know the importance in not leaving my daughter to have to go through making decisions that I am in the position for making this decisions for myself right now. So when we got people that we're caregiving for, we have to help guide them through that. And one of the things that I want to talk about is, how do we do that? What's the best way? So is it getting an attorney? Is that one way? Can we not afford an attorney? What other resources are out there? Because we do need to find out how to organize important paperwork. So can we talk about that, panelists?
Okay, thank you for that question. So there are a lot of forms that you can download online, and then you complete them. And our service, specifically the caregiver responsive support for dementia services, we have a legal assistance that we can refer you to get those papers notarized. So you can do all your own work. You can pull down the forms, and like Monisha was speaking on the healthcare directive, there's a blank one that you can, it's pre-filled, you can add to it, and then you can come to our office at the Friendship Church there on 3333 North, 4th Avenue North, and we have two notaries there. We have a Miss Glover, and we also have a Miss Talana that are notaries. They can notarize those forms for you. So yes, utilize all your support that you have out there, and we would be glad to help any caregiver with their journey.
I was just gonna add a little bit to that. Also, I know that you talked about like what to have in place, and if there's lawyers, there are also, they also have a legal team as well through Volunteers of America. And also she spoke about guardianship. They also have a team on Volunteers of America that works around guardianship and what that looks like if you need to take legal guardianship of your loved one as well. So because sometimes they can't make decisions for themselves, and so someone has to take the guardianship so they can make the decisions for them. And there's a living will, we heard of that, and then there's after they pass away, there's a whole nother ball game. So it's two different things, so you really need to do the homework. And I don't know about anybody else, but I'm tired of the GoFundMes and the chicken fries, and we gotta raise money. I just had 2 loved ones pass away, and we had 2 funerals last week. And so those type of things that have to happen when someone tragically passes away and you don't have everything in place, and so we're scrambling and we're grieving at the same time. That's something we had to do for my mother. We're grieving at the same time of trying to figure out how to pay for this funeral. How are we gonna get let's get this stuff in order beforehand. Let's get life insurance in order beforehand. Let's get our trust funds in order so that they don't have to struggle to figure out where's your bank, who got the money, we don't have to, we're grieving. We don't wanna have to deal with all the layers that come with grieving and trying to bury it. Have those conversations now.
One thing I wanted to add is, based on our communities, we are told to go here, there are all the resources available. But 9% we don't do it. We procrastinate, and we either, sometimes someone doesn't have the internet, and maybe we all went into school, but all those filling out the forms and arranging those things, some of us, is really difficult. So one of the suggestions I would make is that we have legal attorneys, we can create a workshop where we come here one day and then we just say, come if you need something, and then we have the attorney, we have the paperwork at places like the churches or here, and actually get this thing going and make it part of a tradition. Is it quarterly that we hold events like this and have the attorneys come in and do that? But I think telling our families, you need to go to the online and fill this out and go this, I'm telling you, most of us won't do it. At least I know my community will not do it. Some of my members that I have, the adult day center now, it's 6 years old. I've been practically saying, let's put the gloves on because you're not doing it. And so it took some of my friends to really get going because we lost 2 young individuals that we didn't think were going to pass because it just went, they got COVID-19 and they never got over. So let's come up as step 2 of creating some sort of a workshops where we have the attorney, something like a one-stop shop, where the people come and then implement some sort of a culture change, that this becomes part of our culture, because that's not it right now.
I love it, and Fartun, you're absolutely right, because I was just thinking, I know Maria, I understand when there's actions and there's ways you can access stuff, but to Fartun's point, I was thinking it, when you said it, I'm like, even for me, and I'm like, I'm a businesswoman, and I'm involved with the internet, and I'm involved with this, but I'm also busy as all get out. So I took time out and I got an attorney to help me. Even with the help of an attorney, I'm not done with the paperwork. So the majority of people won't do it by just going online. So certainly Fartun, you're right, we're gonna create something where we can have an event. You just gave me another task to do, but I'm up for the challenge. So we're gonna pull something together where we can have something like this, and I'll talk to one of my partners over at Sabathani, and we'll do something over there. We'll help you with the resources. You guys help me to bring the resources to the place, and we'll help the community fill the paperwork out. Because I'm with you, Monisha, we gotta stop the GoFundMe.
Yes.
That just gotta stop. You know, we got We gotta stop. You know, we gotta figure out a better way. So there's a question out here. Will they come to the facility if you're paralyzed to sign papers?
Our program, we will go out and try to assist the senior, the caregiver, with any form that they need. And then let them know how to get it notarized.
Yes, they will go to you, but you also want to look at the facility. They also sometimes have notaries and people on staff that fill it out with them as well. So I know that there's social workers at a lot of facilities. There's people on staff as well as the supports that you can get outside. So look within those and make them, you're paying for them to be there. They're the consumer there. Make them do the work. There's social workers that are within these hospital systems, and a lot of the times we don't know that, and they won't give up these the information that this person is here to help you walk through some of those steps. And so ask as many questions as possible. What services can I get? What's available to me? That's advocating for your loved one. What do you have in place where I don't have to go outside of this facility to go find somebody else to come here? And so making sure you're asking those important questions will get a lot of that information right where you're at handled.
Nice.
I have a notary public, the notary from the bank that signs paperwork that I need done.
Right.
But for some reason he can't sign for health directives.
Yeah, so
is it some different
So
notary?
I will say that there are some traveling notaries. They are notarized to go out into community and do it. So there are different ones that just won't go outside of their lane when it comes to notarizing stuff. But there are, like for my mom, I had to get a travel notary to come to the facility she was at and sign the documents where she was, right? And so I'm glad that there's a resource now like Volunteers of America that will actually meet you where you're at, go into the facility and sign those paperwork. But some like banks and stuff won't go outside of that institution because they're the ones that basically over their notary.
Right.
So they can't.
Right. So who covers the cost for assisted living? Is it Medicare or Medicaid, or does the family just have to pay?
I think that's through the waiver of the county. They will decide based on what waiver you're under. If it's the elderly waiver, which lately wasn't really paying that much, based on the advocacy we're doing right now at the legislation, they're saying they're going to increase it, but it is based on the waiver that you're under for the county. When you have your insurance, there's a waiver, then that will pay. Some may not pay all, some may pay all. It depends on the assessment. You've seen someone comes to you and they do assessment based on what you need. That's another thing. We as Black folk, we don't really fully participate in those assessments. Or grandma is getting someone from the county today visiting. They're not visiting just to say hi. They're visiting to check that person's needs. You need to not only one person, whoever is in the circle of your loved ones, that day you need to be there. Talk about what she needs, her strength, or we're just talking about grandmas today, but dad too, grandpa, your loved ones. Be involved. We are not involved. We're involved in some way to take care of our loved ones, but also when a nurse is coming to do assessment at home or at the facility, please be available. Because once the assessor comes in, they are the ones who will make what services your loved one is going to have. So it's not yes or no question. Say next week someone's going to come from the county, you need to come on down and write things down. What does grandma need? What do your loved ones need? What are opportunities for that if you help her or help the person that you need? What services do you need as a caregiver? That's when you speak up. Maybe you need 4 hours of respite where you could go do your hair. Maybe you need 2 hours a day where you need to go out and walk. Have we checked ourselves? Did our mammogram, our cervical cancer screening, our colon cancer? Hello? We're all dying for those things because we're busy taking care of our brothers, prostate cancer, all of those diseases that are preventable are killing us because we're busy either taking care of our loved ones or dealing with something else. So be active and be involved when your loved one is getting the site visit. And that's where you will know either 0 services, 5% services, or 90% of coverage of what your loved one needs, and you as a caregiver as well.
Okay, I got one more question here, and all of you can answer this if you like. How can someone help from afar? So if you got someone that's a caregiver here in Minnesota, and you got family or friends out of the state, how can they get involved to help support the caregiver?
I'm going to start because I have a parent that is in Kentucky, and I am pretty much her caregiver. So I check in daily, and then I have siblings there too, so I ask them, and I delegate some of my responsibilities. And when you don't have someone that you can call and ask to help you out with your parent that's far away, then you try to include your community, like her church, her friends, just people that you trust that will help you carry out your wishes as you care for your loved one far away.
Monisha, you would like to add to that?
Yeah, I would just say also is really the part of delegating, right? When you're far, is what can you do when you're there? So maybe it's not the hands-on, but maybe it's the budgeting, or maybe you're able to do the bills from afar. So figuring out what you can do from where you're at, and then delegating the things that you can't do hands-on where your loved one is. Also, looking up support services where they're at in their city. And so I helped someone with that. They were, they're here and their mother was in Chicago, and they're like, okay, what supports are there in Chicago? Looking up the zip code, figuring out what support groups, what things that the adult daycares are in their area, what's accessible to them where they're at, that will actually help you as well.
Good one.
I would say the person who is not here, please be the peacemaker, the person who becomes an emotional supporters for the person who's carrying beside the administrative, the checklist. Have you done all this for yourself and for mom? But also when conflict arises, the caregiver gets a little bit burned out. That person becomes the ambassador for soothing the environment out. Sometimes the person who's being cared for and the caregiver can have conflict. Someone needs to be, the peacemaker, the making everything cool, and also making sure that the finance is taken care of, bills are paid. Right now we're seeing a high rate of evictions of communities of color, and so make sure the bills are done. And when mental health is involved, say like you have all the symptoms, you're a health educator and there's a social worker, when you see the caregiver having some health crisis, that's where you don't wait until things got burned out. It's where you do intervention. Whether you call your church, we know all of us, we want to be private. We don't want to tell anybody to our affairs, but develop a circle of trusted friend to say, hey, I'm a little bit burned out, help me out. And those friends, my message is, please keep things private. Don't talk about your friends' issues, because that's what keeps us isolated and burned out, because we can't trust so-called friends. Just keep it private, support one another, and be the peacemaker, because we have a long way to go, making sure our loved one survives. And if they're leaving us, they leave with dignity.
Oh, thank you. I just want to wrap. Oh, go ahead, please. And I just want to wrap it up just by also saying, because being that I am a caregiver too, it's like, again, I started off by saying a lot of times we take on more than we take on a lot, and sometimes we think it's more than we can handle, but usually we just have to organize it a little bit better. But there are days when caregivers get stressed out, and we do end up needing some type of affection or timeout or something. So I'm gonna give you a really cute story to take home with you today. So one day, last week, I typically am a very upbeat person, and I can handle a lot that comes at me. That's just my built. But that day I was wiped. I had all that I could take. And I had to call my daughter. It was in the late evening, and I was just like, I just want to say one thing. I'm gonna get off the phone. I'm gonna go sit down and relax and just kind of unwind. I said, I didn't have a good day today. And again, because a lot of it is just stress. I got a lot of stress because I'm doing a lot of different things in addition to caregiving. So the next thing I know, I get a phone call, and it's one of my grandsons. And he said, hey, Gaga, how are you doing? And I said, I'm doing okay. I said, oh, I'm doing okay. How you doing? I'm thinking just calling me. And I said, what's going on? Because I'm not trying to really talk. I was just talking to his mom and said I was trying to get off the phone, And I'm like, so what's going on? Nothing, Gaga. I just called to see if I know you're having a hard day. I just wanted to make sure you're doing okay. And then the baby followed up with the text, and he said, I love you, Gaga. All that made my whole day so much better. So I'm just saying, reach out and touch somebody. That's right. It's just that simple. You don't have to be there. You don't have to always have money. And it don't take a lot of time just to reach out and touch somebody.
Call somebody. Call.
Thank you, panel, for joining us this afternoon. They're not going away right away. They're here to answer more questions. In the meantime, we're going to get up and do a little shopping around and a little dance. I think we got a little dance we got going on. I think she was going to put the little stepping thing on or something like that. So don't go nowhere. We'll be right back.
Sister Spokesman.